Welcome back, everybody. You are still tuned into the Now Morning Show. If you are just tuning in, though, good morning to you. Good morning to all our listeners on Talk City 91.1 FM and wherever you are in the world on the Now Morning Show Facebook page streaming live. Thank you for being here with us this morning, and we are looking forward to it. Now we're going to go into a chat with Dr. Erica Wheeler, who is the PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler.
Good morning, Carrie. How are you today?
I am doing great. It's great to have you this morning to continue educating us on, all things COVID.
Right. I'm
All right.
ready.
So the COVID pandemic still exists, of course, and overseas we are seeing cases soaring in places like Florida, while at home we have managed to flatten the curve and have now had reduced restrictions. So, but the question is, are we taking the pandemic situation seriously enough?
Well, again, good morning, Carrie. And
Good
that
morning.
is an excellent question. I would say the first thing we need to remember is until everybody is safe, nobody is safe
Right.
because this is a global pandemic. So, therefore, it means that we are, as an island, still open to persons coming in with COVID-19. And yes, the government has done an excellent job of flattening the curve, as you said. We have had mainly imported cases, but we cannot and we must not become too complacent because we have what's called sporadic cases, meaning imported cases or just a few local cases, which we don't have right now. So I would urge people not to become complacent because these good habits that we are meant to develop and we started practicing, it just takes one or two cases that go undetected from people coming into the community to start up a second wave. So no, we should not become complacent.
So we're seeing that some countries that reopened are being hit badly with a second wave. How do we prevent the same thing from happening here in Trinidad and Tobago?
Well, Carrie, I think we have to do what the government has been doing so far is to ensure that anyone who comes into this country, either legally or illegally, that we certainly keep an eye on persons who are coming in illegally and they have to be quarantined and tested. But for those, once the borders open, I think this is our big issue now, isn't it? Our borders are closed, but we cannot keep our borders closed forever. So, therefore, in the meantime, and even when our borders are open, the main weapon we have is to still practice public health measures because the truth of the matter is we still don't have a vaccine. The treatment that's been identified so far, that's for people who are severely ill. It is not a protection. It's not what we call a prophylactic. So therefore, we still have to remain vigilant. This is an invisible virus. So we can't just take it for granted, even though, yes, it is true, we don't have community spread, but we can't afford to let our guard down. I was just looking at the figures. As you mentioned, the US now has 2.4 million cases.
Right.
This is a country that we will get persons from as soon as the borders are opened up internationally. We know there are cases in other islands of the Caribbean. Yes, they have managed to flatten the curve also, but we still have to be vigilant.
Definitely. Now, you mentioned earlier that, of course, we can't keep the borders closed forever. But what is the way moving forward in which they should reopen the borders? Should there be restrictions on people from countries that are heavily affected by COVID? Should there be other measures in place to protect us further? Because we all know that if the health system is overwhelmed, that would affect our country so much worse than if we, kept the borders closed a little longer. So how do you think we should be reopening the borders?
Right. So I was very interested to see what Jamaica is doing. They are putting a lot of steps in place to ensure that when persons enter the country, not only are they thoroughly checked, they are tested, but they also have an app that follows them. So the government knows where they go. When we opened the borders, just as before when the borders were closed, and the government identified those countries where there was a high incidence at that time, relatively speaking, of COVID 19, the government took steps to say, well, there's certain countries that we would not allow persons in from. Now, that is a decision of the government, but it appeared to work that those countries who have the highest incidence, for the time being, the government said, no, we won't have those people from those countries coming in. So they may have to take similar decisions. Of course, that is down to the government to make that decisions. And I also see that there are air bridges or air bubbles being set up. So some countries are still allowed to have persons traveling between them. But certainly, we will have to have extremely strict measures about those who come in, and very importantly, to continue having the capacity to test persons who are coming in. Because right now we have no what's called rapid tests, which means as you enter a country, you can't be tested and within 2 hours there's a result. So it means you do have to be extremely careful of putting a series of steps in place, even before persons leave their country of origin,
Right.
in terms of, making sure that they are tested and they can come with their negative test. And when they arrive, they have to go through a number of procedures which protect themselves, that protect people in the airports who will be interviewing them, who will be dealing with their paperwork. We need to have medical people available at airports who can do the testing, because testing for fever alone is insufficient. That
Right.
is very clear. We can do use thermal scanners, but we also do need to have the capacity to actually test people in the airport and ensure that we know where they are when they're in the country, because we are fighting an invisible enemy, and we
Definitely.
can't not take these strict measures once the borders are open.
Would you agree that the suggestion of a mandatory quarantine would be something viable?
Well, that would be extremely difficult. If you are a tourist coming into a country, to put you in quarantine for 2 weeks, the question would be, who will pay for that quarantine? And if you come on a 2 week holiday and you are paying for yourself, to stay in quarantine for 2 weeks is a long time. So we have to have some other method of tracking people to make sure that we know where they are once they are tested. Because, of course, once you enter a country, if you enter and you are not symptomatic, you are asymptomatic or pre symptomatic at the time, you can still develop COVID 19 if. You had it. Remember, the period of time is 14 days. So, anywhere within those 14 days, you can still develop it, even though you may test negative before you leave your country of origin now. But that is an added precaution if you
Right.
get tested within 72 hours. But you are still, you are still capable of spreading the virus within that period of time. So quarantining someone for 14 days, if you're a tourist, is, man, that's a very challenging thing to ask people to do, and pay for themselves for 14 days for a 2 week holiday.
Right. No, very, very difficult. And, I guess some method would have to be developed to address things along that line as well. And before we go, just considering how well Trinidad and Tobago has been doing in regards to, restricting the numbers of COVID-19 cases and the rate of infection, just how, now that certain restrictions have been released or removed, just how at risk are we still at this point, considering that within our population so far it seems that we don't really have local spread and community spread and such, because uh, with the bars reopening and stuff like that, the Prime Minister did say that if he does see the similar behavior that he has heard reports of, he would have to roll back that decision to allow bars to be open. So really, just how at risk are we?
Well, okay, so we're balancing a few things in our public health measures. We do not have evidence that shows that we have a high risk. simply because we don't have what is categorized as community spread. Maybe I can read it. It says, countries for community transmission, countries or territories or areas experiencing larger outbreaks of local transmission, defined through an assessment of factors that can look at the large number of cases linked to persons coming in, and multiple related clusters. We don't have that as a definition of community spread. Clearly we have sporadic cases, which speaks to cases that are imported or locally detected. Now we know that there have been tests carried out at the community level, and so far we have not detected COVID-19 circulating. um, and I think that might be something that people would say, okay, we don't have it, so therefore we don't have to bother with any public health measures. But the truth is, if you don't build up and practice good public health measures, when the borders are open, we can easily go back to square one if we find any persons who have come into the country and it has not been detected, and somehow it starts circulating. We don't know. And this is the difficulty about it. We simply don't know if that will happen because we haven't had our second wave. The governance and the measures put in place have been extremely good and working so far. But we can't take it that we will never, ever, as Trinidad and Tobago, be in that situation. So, yes, I understand it is out of an abundance of caution that the Prime Minister is making these remarks, because once you develop good habits, when we do get a second wave in whatever form it comes, we will be better prepared to combat it. But right now, it is clear that we do not seem to have any community transmission. So we are not immediately at risk, put it that way.
All right, and that is good news so far.
So Dr. Wheeler, just sorry to interrupt there, to just interject for a second. What you're saying sounds like we are preparing for the worst case scenario, but we just have to be prepared as a country so that we are training people in the country to be able to act correctly in case of a resurgence, yes?
Absolutely correct.
Okay.
Because if we do have a resurgence and we have not been practicing good public health measures, then we will be in an even worse situation than we were before. Because remember, it's not only adults we have in our population. We have children to think about. We
Yep.
have the elderly to think about. We have persons who are vulnerable, for example, in homes for the elderly. And we see abroad that these persons are the most vulnerable. So we do have to think about others. And this is what this virus is teaching us, that it's not just about us. We have to think about our families, we have to think about our communities, and we have to continue to spread the messages about good hygiene, um, and about keeping our environment clean, about wearing our masks, and so on. So even PAHO at this stage, we are still ramping up our messages that we call risk communication messages. And we will be putting out messages out there about continuing good public health measures, because the truth is, as I said, we do not have anything else to protect us at this time. And if we look at the Spanish flu a century ago, they had to do some of the same things that we are doing now. So we need to keep up our good public health measures.
Right. All right, and with that, I want to thank you so much for joining us, Dr. Erica Wheeler, PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. As usual, giving us a lot of very important and pertinent information.